Hello. Today I would like to discuss something very important to me, which is mental health. I have a lot of friends who were at the borderline shooting in November of 2018 who struggle with mental health issues from that, specifically post traumatic stress disorder. It's something that I try to help many people through. A lot of my friends still struggle with it to this day. Post traumatic stress disorder is a psychological disease that a great number of people around the world struggle with every day. Last updated in 2020, the U.S. Department of Veteran Affairs found that an average of 4% of American men and 10% of American women will receive a PTSD diagnosis at some point in their lifetime. So today, I would like to discuss PTSD. I will first discuss the prevalence of PTSD in the armed forces, second, the risk factors of PTSD, and third, the treatment options. The first account of PTSD in the military goes as far back as 1861. During the American Civil War in the 1860s and the Franco-Prussian War in 1870, medical professionals began to document medical attempts to address the psychological issues associated with military veterans after the exposure of combat, as stated by the United States Department of Veteran Affairs, last updated in 2020. The early description of PTSD was feeling sad, sleep problems, and anxiety, and this definition was a model for the disease at this time of the American Civil War. A second model suggests that physical injury was the cause, marked by rapid pulse, anxiety, and trouble breathing. Throughout the mid-1900s, the APA, the American Psychiatric Association, produced the first official diagnosis of PTSD, which was named gross stress reaction at the time. This was the diagnosis for seemingly normal people who had symptoms following a traumatic event, but it assumed that the symptoms would resolve quickly, and it had to be re-diagnosed after 6 months and the symptoms were persistent. This diagnosis was eliminated in 1968, but the new diagnosis was limited to 3 examples of trauma, including unwanted pregnancy with suicidal thoughts, fear linked with military combat, and prisoners who faced a death sentence. In 2013, the 5th definition of the Diagnostic and Statistical Manual of Mental Disorders was written, and the first diagnosis to no longer classify PTSD as an anxiety disorder. Since then, PTSD is associated with other mood states such as depression and with angry or reckless behavior instead of anxiety. Since the PTSD is associated with other mood states such as depression and with angry or reckless behavior instead of anxiety. The new classification of PTSD is trauma and sensor-related disorders. Now that we have discussed the development of the PTSD diagnosis, we will move on to discuss how one can recognize PTSD in others or yourself. Secondly, I will talk to you about how to recognize the symptoms and who is more susceptible to PTSD. The symptoms of PTSD usually begin within 3 months of the traumatic event. They last more than a month and affect relationships or everyday activities, and that is what is considered to be PTSD. The symptoms in adults must include at least one re-experiencing symptom, at least one avoidance symptom, at least 2 arousal or reactivity symptoms, and at least 2 cognitive and mood symptoms for at least 1 month to qualify. Children respond to post-traumatic stress disorder differently than adults, and their symptoms may be different. Symptoms of PTSD in children can include wetting the bed even after being toilet trained, forgetting or being unable to speak, acting out the event while playing, or being unusually clingy. As children get older and become teenagers, the symptoms become more like the symptoms in adults, and they may also develop disrespectful or destructive behaviors, or have overwhelming feelings of guilt or a need to get revenge. PTSD can develop in anyone at any age. The National Center for PTSD states that 7 or 8% of people will experience PTSD symptoms at some time in their life. PTSD can occur in anyone who has been through a traumatic event such as physical or sexual abuse, an accident, a disaster, or other serious event, and can include war veterans, civilians, and even children. However, not everyone who has PTSD has been through a large disaster or disastrous event. Some people can develop secondhand PTSD when a friend or loved one goes through a traumatic event. While anyone can develop PTSD, women are more likely to develop than men. And some may be genetically predisposed to PTSD symptoms. Once an individual is diagnosed with PTSD, these symptoms must be treated by a mental health professional. Lastly, the treatment for PTSD is most commonly medication and or talking with a therapist. The National Institute of Mental Health says the most common type of medication used for PTSD are antidepressants. They may help to control symptoms such as sadness, worry, anger, and psychological numbness. They may help to control symptoms, and other medications may be useful for treating sleep problems and nightmares or night terrors. Each individual patient will have a different medication combination and dosage that works best for them. Talk therapy or psychotherapy is another treatment for PTSD. During this therapy, a mental health professional speaks with patients one-on-one or in a group to support those with PTSD and family members of these individuals. Mental health professionals may use cognitive behavioral therapy, which includes a combination of exposure therapy and cognitive restructuring. Each individual also needs to develop skills to deal with their PTSD on their own. While in treatment, patients need to find ways to reduce stress, set realistic goals, be open and honest, and try to spend time with others. Patients also need to communicate with their friends and family about their PTSD stressors and triggers to help reduce their symptoms. Today, I talked to you about post-traumatic stress disorder, commonly known as PTSD. First, I talked about the history of PTSD in military veterans. Second, the symptoms and risk factors of PTSD. And third, various treatments for PTSD. PTSD is something that can affect anyone. One should be mindful of those with PTSD symptoms and be sensitive to these individuals' triggers and stressors. If you notice someone needs help, please reach out.